Hello, everyone. My name is Javad Parvizi. I'm an orthopedic surgeon practicing at University of Acıbadem in Istanbul. I have the distinct pleasure of introducing you to somebody who doesn't need any introduction. He's one of my greatest friends. I've known him over 2 decades. Thorsten Gehrke from Endo Clinic. He's the chief of Endo Clinic, one of the most spectacular surgeon educators I know, brilliant in every shape or form, and I have been very fortunate to know him. So Thorsten is going to tell us about the history of ICM. Why did we start ICM? Thorsten, welcome. And what we would like to hear from you is why ICM.
First of all, welcome, Jay. Hi. Very nice to see you. It's always great to see you because we are always traveling around the world, trying to spread the messages of the ICM results and in general the PGI issues all over the world. So it's always great to see you, and thank you so much for your great introduction. I could give it back in the same words to you.
Thank you.
Um,
Thank
yeah, you know it. We both know how it started. It was in 2012. We were involved in a project which happened in London, and after the meeting, we went to the Hyde Park, and
you.
whenever we met, we were always talking about PGI. And we came to the conclusion that it's extremely unsatisfied in any issue. I mean, in diagnosis, in treatment, even in pathogenesis, and so on. And then we went through the literature, we tried to learn from each other. And then we came to the conclusion that there is no evidence at all.
Mhm.
The science behind PGI was extremely thin during that time. It was 2012. So we were sitting down in the Hyde Park, it was a very hot
Few
day.
beers,
We had some
few
beers
beers.
together, as always.
I remember that part. Yes.
Yeah, and I don't know who had the idea actually, but I think it was you. I assume it
No,
was
no,
you.
I think I think we came up together. We
Yeah,
basically said, look, this is not working, so why not get our friends together and come up with like some recommendations, etc. I
yeah,
think that was a brilliant idea that you actually you had a fantastic group of network of friends around the globe, and you said we'll just bring all our friends, experts, sit down and talk about where we are.
yeah.
So you said it was not very satisfactory in 2012. Do you think much has changed since then, Thorsten? Has PJI moved forward very much?
A lot changed, especially in my opinion, in the field of diagnosis,
Mm,
PGI. We are today, we are a lot of steps further than 13 years ago, but
mm,
we still are looking for the ideal diagnostic tool,
mm.
which is not there still, and it's not there yet. And let's talk about treatment. You know, I'm a defender of the one stage exchange treatment.
You were the Lone Ranger when you were on the podium talking
Yes.
about one on stage 20 years ago. People thought you were drinking something unusual. But now, are you happy that one stage exchange now gaining more popularity? I mean, your education has certainly contributed to it. Are you happy with this?
Mm, we are partially. I would say it gained a lot of popularity. All the randomized trials are quite convincing, which happened in UK with Sweden, which happened in US recently under the lead of Tom Faring. But there are still so many question marks. And I mean, my mission now is to give the patient an optimal treatment has to be done in an extremely specialized environment. And that means a specialized hospital for PGI treatment. We all know we need a multidisciplinary approach to treat these poor patients, and this needs something like a special hospital. So,
So
and
you
this
bring up,
is not there any at the moment. There's only one country, it's France, who really has dedicated centers for the
Mhm.
treatment of PGI, but the rest of the world, every surgeon is doing what he believes.
So that's one of the, I visited you obviously multiple times, but one of the things that you do there is you employ multidisciplinary team. Surgeon obviously is very, very important. And I think if I remember, you have septic surgeon and non-septic surgeons, even that. So the protocol, how to manage PJI patients altogether is very, very important, but particularly very important on how to do on a stage exchange. Is that correct?
That's
That's what you think.
that's yeah, that's correct. Yeah, that's correct. But even if you are performing a two-stage exchange, you need exactly the same team. You need
Mhm.
experienced surgeons in septic surgery with all the skills that are needed, with all the skills to do a proper debridement and so on. So this is independently of one stage and two stage. And if you ask me, Jay, I don't know what's your opinion. If you ask me, so we did in total three ICMs. We put it all together. We had so many experts and we did a lot of progress in the theoretical knowledge and the background. But do you think that we have less periprosthetic joint infections due to those efforts?
I think definitely we're making progress in prevention, but to your point, we're also making progress in diagnosis because your point is very valid. You know, in the old days when we used to call something aseptic, it probably wasn't aseptic. It's just that we either didn't have the right test or we didn't even look for infection. Now, thanks to educators like yourself, people are looking for infection and we are probably detecting more of them. So, but I agree with you, though. I think we have made some progress, but not as much progress as we would expect. But that's also probably true in orthopedics. Why do you think that is, Thorsten? Why is it so difficult to make progress in the field of PJI?
I think again, we need surgeons who are willing to do this work. And that's a big issue all over the world. Nobody wants to do this hard work, treat these poor patients, surgeries which are lasting 3, 4, 5, 6 hours with mega implants, with huge debridement, extremely time consuming. The results are not extremely good sometimes. So we need we need to organize, and this is probably more a political part. We need to
Mhm.
organize a basis on which, I mean, specialists can work in a very good environment, and I don't mean just the scientific environment or surgical environment. I mean also the monetary, financial environment that
Mhm.
gives them the chance to do this kind of work with some benefit for them. So if you don't get any benefit for this, sorry, shitty work,
Yeah.
then nobody wants to do it anymore.
Yeah, no, that's a great point. And I think it's been tough for industry to innovate in the area as well because of some regulatory barriers, etc. But we can't thank you enough for your dedication to this field. I've learned a huge deal from you. Besides our friendship, I think you've been one of the most influential people in my life in terms of teaching me. So please continue to work as hard as you do. Continue to educate us. Continue to take care of those challenging cases. I am personally very honored and privileged to have your friendship, Thorsten. I could talk to you for hours, but we would like to, I'm sure our audience would love to hear more from you. Perhaps we'll come back and discuss more in the future. But in the meantime, thank you for setting time to talk to us because I know it's already late in Germany right now.
Hmm.
And you probably flew from somewhere last night and you're flying back tomorrow. But thanks again for your time, Thorsten. It's always a pleasure talking to you.
Thank you so much. Same here. Same
Thanks.
here, my
Thanks.
friend. Bye.
Thanks.